Hello, welcome to our summary board meeting roundup. This month's board meeting, which happened on Tuesday the 26th of November, our Chief Executive gave an overview of key system news. Ed Garrett said he was delighted that the new Essex and Suffolk Elective Orthopaedic Centre has opened and had treated its first group of patients. He described it as a world-class facility and a proud moment.
72 beds, 8 theatres and 300 jobs created. I think it's a 60 million plus investment for our community. It's worth reminding ourselves that it's named after Dame Claire Marks, who's unquestionably our finest leader that we've had in SNI, and she was the first female president of the Royal College of Surgeons and the first female president of the GMC, alongside all of the work she did clinically here in SNI. So very appropriate that her legacy is recognised in this way.
Ed said building work is progressing well on the new Community Diagnostics Centre in Newmarket. He said by the time the next board meeting takes place in January, the facility should be open. Community diagnostic centres offer patients a wide range of diagnostic tests closer to home and greater choice on where and how they are undertaken, which reduces the need for hospital visits. Plans are also progressing for a centre in Ipswich. Ed also gave an apology to the people of North West Ipswich after the ICB announced it was no longer affordable to develop a new GP facility on the site of the former Tooks Bakery. He said it was incredibly disappointing for local people and for the ICB. Ed mentioned that he and Maddie Baker-Woods, the director of Ipswich and East Suffolk Alliance, would be working with partners to find an alternative solution. Suffolk County Council has received a letter from the Department for Education which recognised improvements in the provision of SEND. Ed said he would want to see those improvements sustained. He also said he recognised the excellent progress being made at NSFT in relation to the Family and Friends test score, which has improved by 20% over the past year. The Family and Friends test is a tool which allows people to provide feedback on their experience. The ICB has appointed an allied health professional chief officer. Penny Casson, who has worked in the system for many years, will be invited to a future board meeting to outline the work she's doing to support AHPs. Now, the director responsible for dental, Peter Whiteman, says the system is developing a workforce strategy aimed at encouraging more people to work in the profession across SNI.
We've had 4 dental surgeries who've put vacancies onto a large platform to help anyone who's looking for a dental role in Suffolk and North East Essex. Those 14 practices now come up, and we've already had 4 staff recruited through that process, and so we're looking to extend that further, and we're also there's a national incentive scheme for new dentists working in the NHS for the area, and we've been successful in supporting practices with that to date, and we've been just starting some work with therapists, which is the new dental workforce that can do so much of the treatment, to think about how we can, when all the graduates coming out, how we can cement their place in the NHS dental workforce of the future.
The Director of Workforce and People at the ICB, Amanda Lies, told the board that the Race Equality Standard and the Disability Equality Standard are designed to ensure all staff, regardless of race or disability, have equal opportunities to thrive. But the reporting shows experiences of minority groups differ from other groups in some circumstances within the organisation. The board heard from 2 colleagues who spoke about their experiences. Tina Lata chairs the Disability Network within the ICB.
Disabled people and people with a long-term condition are still expected to fit into a working environment and a working culture that is not adaptable to them. Discrimination, bullying, harassment therefore become the default. Disabled people are not allowed to thrive. We become the forgotten cohort of communities and the forgotten cohort of staff. As chair, I am passionate about making this change because the next cohort are just behind me.
And Lisa Stevenson, who chairs the Reach Network, said she's previously been told to keep her head down, which she's told the board was the wrong message.
When I joined the CCG at the time, I was told at times, just keep your head down. And I think we need to get people to stop keeping their head down. If I'm kicking Tina, Sarah's here. Lisa, what are you doing? That's what I want. That's what I want us to be like. And I think once we start doing this, we will see so much change.
Ed said more is needed to address the issue, and that having a Speak Up service which allows people to share their concerns in confidence is not useful if staff are too afraid to come forward. The Deputy Director of Strategy and Strategic Programmes, Lorinda Evans, shared a paper with the board which proposed the alignment of ME, chronic fatigue and long COVID services by next summer. Members were told that there are similarities in symptoms for these post-viral conditions. Lorinda said the new model will create the opportunity, post-diagnosis, to provide alignment of treatment and to ensure best value for money.
This is quite an exciting proposition because we would be the first in the country to have such an aligned model, which would be consultant and GP with special interest led, a multidisciplinary service. So an exciting way of bringing those services together to support people.
The ICB's Commissioning Intentions 2025 to 2026 document was noted during the meeting. The report outlines which services would be commissioned by the ICB over the next year. The intentions follow the system's Live Well domains. The Chief Executive of ESNEFT, Nick Hume, said while it's right that the document is ambitious, its delivery would be very challenging.
Without dampening it, it's great, but pragmatically, it's going to be really tough to achieve this, and we may be in a position as a board of making some difficult choices into the next financial year about where we prioritise our work.
The lead director for emergency preparedness, Laura Taylor-Green, gave an overview of the EPRR core standards report. This year, the ICB is substantially compliant against the core standards, with 43 out of 47 standards fully compliant. Laura said, while positive, she expects the ICB to fully meet all standards. The Director of Finance, Howard Martin, said that the SNEES system has an approved balance and system plan. He said that while the system is confident it will balance its financial position, there is a significant overspend at West Suffolk NHS Foundation Trust. The Trust's Chief Executive, Ewan Cameron, gave an apology to the wider system about its organisation's financial position and said the Trust is committed to bring about financial improvement. The group heard that the system's financial position next year is expected to be very challenging. And Susanna Howard, the ICP Director, spoke about efforts to co-create an insight and oversight group. Service users and patients, family carers, voluntary sector staff and volunteers, among others, attended a workshop in November to discuss ways to develop the approach. Once established, the group would inform and provide expertise to various groups at the ICP and the ICB. Well, that's all for now. The next board meeting will be on the 28th of January. For more information, please visit suffolk and northeast essex.icb.nhs.uk.